Hello, everyone. Welcome to the seminar Talk with the Expert. Today, we are going to have an incredible guest here with us and talk about a very important topic. Use of medications for ADHD, depression, and anxiety. They are doping. So, this seminar are created to support give information to athletes, coaches, parents, and all athlete support personnel. I'm Juliana Soares, anti-doping manager, and it's an honor to receive here today with us Dr. Mohy El-Din. It's a TUEC Chairman committee from Virtus World Abilitysport and IBSA, and it's a pharmacist with a post-graduation in drugs in sport from International Olympic Committee. Thanks, Dr. Mohy, for being here and share with us your knowledge.
Hi, Juliana, and thank you. And it's my pleasure to be with you and with our friends from our federations.
Thanks, Mohi. Um, let's start. So, as you know, doping is a challenge on the sport and affect not only the integrity of the competitions, but also the health of our athletes. So, the seminar I managed to raise awareness about the medications and how they can be a potential risk of doping violations. We know that some athletes can have a DHD or depression, but we know that the attention with the use of the medications to make their lives even better must be very strong. Doctor, are the medications for DHD, depression, and anxiety are considered doping or not?
Okay. Hello, our friends. Hello, our heroes. It's my pleasure to be with you today to discuss a very important topic, which is the medications for ADHD and depression in the sports. Well, as a chair for the Therapeutic Use Exception Committee, I wanted to begin with a very clear and very strong message, which is your health always comes first. Okay? Many athletes, especially in para sports, may need medications for conditions like ADHD, depression, and anxiety. These conditions are real medical conditions. It's not a weakness, not something to hide. And taking care of your mental health is very important. It's very important as taking care of your physical health. So, from anti-doping perspective, we need to understand something important. Not all medications are treated well. How? Some medications used for depression and anxiety are full, allowed, safe to use in sport without any special permission. But some medications used for ADHD, especially stimulant medications, are prohibited in competition, prohibited during the competition. Now, this is where confusion happens. An athlete may think, my doctor give me medications, so it must be okay. But in sports, this is not always true. Why? A medication can be medically correct, prescribed by a doctor, but still restricted under anti-doping rules. So, yes, if used without proper steps, it could lead to a doping problem. But I
Mm.
want to be very, very clear again. The system and the doping rules not here to punish athletes who need treatment. It's here to make sure that everyone competes fairly. Okay? So let me give you an example, a very simple example to clarify this point, please. An athlete with ADHD takes stimulant medications to focus better in daily life. This is completely valid medically. Okay? But during competition, this medication, which used to treat ADHD, could also improve focus, increase alertness, and reduce fatigue. And that may give an advantage over other athletes. So the rule is not don't take it, but the rule is use it correctly and with approval if needed. And that's why the TUE system exists. So, the message I want every athlete to remember is you are allowed to treat your condition, and this is your right. You are supported in doing so, but you must check your medication and follow the correct process to avoiding any anti doping issue. And you are not alone in this. We are all here to help you.
Oh, it's really great. I remember last year we had a very long conversation about this, And please, I suggest you to go back to the previous years to listen again our conversation with Dr. Mohy about this specific topic. But doctor, I understand that as you explained, for example, some medications can be used just in competition, but not all the medications can be stopped at the treatment. They must continue. So if an athlete needs a medication for real condition, it's a real medical condition, what they should do to stay in compliance with anti-doping regulations, what they need to do indeed.
Okay, this is where we are from understanding to action. Okay,
Okay.
as TUEC, our role is not just to evaluate, but to guide and support athletes. Okay, so let me explain this in a very simple and practical way in steps. Step one, get the correct diagnosis. Everything starts here. You need to see a qualified, specialized doctor who will listen to you, evaluate your condition, and make a proper diagnosis. For example, for ADHD, it's not just I am feeling distracted. It required a proper medical assessment from a specialized psychiatric doctor. Step two, get the right treatment. Your doctor will decide which medication is best for you and what the dose you need. At this stage, your focus is on your health, not sport rules yet. Step 3, check the medication status. And now we bring in the anti-doping side. You must ask, is this medication allowed in sport? This is very important step because if the medication is prohibited, you need to take the next step, which is apply for TUE. A TUE, which is therapeutic use exceptions, means you are officially allowed to use a prohibited medications because you need it medically. As a TE committee, we carefully review your diagnosis, your medical history, which why this medication is needed, whether other allowed or alternatives allowed options could be work, okay, and which these medications may enhance your performance or not. If everything is clear and justified, we approve your TUE. Step 5. Keep everything documented. We advise you to save your documentations because it's very important. You should always keep medical reports, prescriptions, and your approved TE. Because if you are tested, you must to able to upload. You must to able to show I am using these medications correctly and legally. Okay. And step 6, communicate. Please don't manage this alone. We are all here to help you, to support you. So involve your doctor, your team, and your federation to support you and guide you to the correct way.
Perfect. It's very important. We receive many TUEs in our federations with incomplete documentation. They send just sometimes the form or they send just the medical report. As you explained, we need everything to understand why you need this to grant to approve a TUE. So please, guys, again, go back to the seminar we had last year to understand everything. Okay. And if you have any questions, as doctor said, we are here to guide you.
Yeah.
I just have another question that make me a little bit confused sometimes, doctor. Why some medications for DHD are prohibited and for antidepressants or anti-anxiety medications are allowed? They are not all them for mental health.
Okay, this is the question is very important because it helps athletes to understand the logic behind the rules. Okay, the anti-doping rules are based in two main principles, as I said, fairness and athlete health. So let's talk about ADHD medications first. Some ADHD medications, especially stimulants, as I said, can increase concentration, can improve reaction time, can reduce fatigue, can increase alertness. Now, imagine an athlete in competition with faster reactions, with better focus, with less tired. This could give an unfair advantage, right? This is why these medications are prohibited during competition unless approved through a TUE. But again, I want to stress these medications are not bad. They are important and necessary as treatment for many athletes. They why we don't ban them completely. We just regulate their use. Now, let's look for medications for depression and anxiety, for example, which are not prohibited. Most of these medications don't increase performance, don't make athlete stronger or faster. They just help athlete to be more stable, more calm, and normal. By the other words, these medications don't affect the performance, so they are usually allowed. From a TUE perspective, we always ask, is this medication restoring normal health or giving extra advantage? This is the key question. If it's to restore normal function and normal health situation, usually allowed. If it may enhance performance, may be restricted and prohibited. It's designed to protect fairness and protect athlete health. And again, when there is a real medical need, we have a solution, which is the TUE system to control all the process.
Oh, understood. So this is why, because they work in a different way from for the athlete's perspective.
Mhm.
Okay, now I got. Thanks, doctor. But we are still receiving in our federation some toys with a mistake or misunderstandings. That I think the most of them are misunderstanding. So could you tell me the most common support staffs and athletes can for these medications?
Okay, this one of the most important parts because many problems can be avoided with simple awareness. Okay, from our experience in the TE committee, unfortunately, we see the same mistakes again and again, about repeated 5 mistakes. And let me go through them clearly. Okay, the first mistake. May an athlete thought that my doctor prescribed it, so it must be allowed. That is the most common misunderstanding. Every athlete should know that the doctors focus in your health, your physicians focus in your health, but some of them may not always know the all anti-doping rules. Okay, so how to solve this point? Always double check the medication status with the anti-doping committee in your federation. Okay. Second mistake. Some athletes may don't know about TUE or delay the application for TUE. Please apply early and please don't wait until the competition. Please. Okay? Okay. Third mistakes. Weak or incomplete medical documents. Especially in ADHD cases, we sometimes receive incomplete diagnosis or missing reports. This make very difficult for us to approve the DE. How to solve it? Please revise or go back with the specialized psychiatric physicians who know how to diagnose your conditions well. Okay, and please sure that everything is clear and complete before apply for TUE. The fourth mistakes we faced, poor communication. The athlete know the rules, but the coaches doesn't, or the doctors doesn't understand sport rules. Okay, and it is create from confusion. We can solve it by deal with an athlete should be aware about the anti-doping rules and to keep everyone informed. And that's why we make this educated awareness. Okay. And the last mistake we repeatedly faced, which is fear-based decisions. Some athletes get scared and stop medication suddenly or hide information. This is very, very dangerous on your health. Please always be calm and be sure if you suffer from medical condition, you have a right for treatment and to speak openly and ask for help, and you will find us backbone for you and supported to you. My final message for our friends and for our athletes. As a chair for TUE committee, I want to confirm that We are not here to catch you. We are here to support and help you. You have the right for to be healthy. You have the right to treat your medical conditions, and you always have the responsibility. You always have the responsibility to follow the anti-doping rules. If you ask, check, document, communicate, then you can compete safely, confidentially, and fairly. Thank you.
No, it's really, you wrap up everything perfectly, Mohi. I think indeed they are the mistakes that we have more often with us. And when I talk with the athletes, I always say, please tell your doctor that you're an athlete, because sometimes they don't know how they can avoid to prescribe a prohibited substance if the doctor doesn't know. So you need to tell them. And if you are not 100% sure that it's not a prohibited substance, or it's allowed or not allowed, all them can contact us. It's I always answer our questions. So we just send an email. I pass to Dr. Mohi to double check because I don't know about medicine. So poor Dr. Mohi all the time is receiving emails from me like, could double check this medication, could check if it's okay. So please tell your doctor that you're athlete and you pass through anti-doping controls, and could avoid a lot of problems. And if you need, like Dr. Mohi said, just request it too. Don't avoid or don't hide the information. We are here to protect the clean athletes, not to hunting anyone. So thank you so much, doctor, for all your
Thank you.
explanation. I think was very clear. Again, guys, Dr. Mohi talked with us last year. Go to our YouTube channel and check the list of our seminars. He explains step by step how to proceed with TUE. It looks like very complexity, but you are not going to do alone. So don't worry. We are here to support your medical doctor is with you. So we are a team together to help you. Doctor, again, thank you so much for being
You're
here,
welcome. You're welcome.
and we give us so many information about medications and these specific medications that every day we have more applies, more requests for this type of TUE. Let's the conversation keep going, holding integrity in the sport. Thank you so much. Our next video will be posted on next month. So pay attention to social media. And again, Dr. Mohi, thank you so much.
Thank
Thank
you.
you, everyone. And remember, the Rio champions play clean. Ciao.
Ciao.